Hi guys, welcome back to the channel. So last class we have started with mucormycosis. We have seen that we have started with some other fungal diseases in which we have seen histoplasmosis, coccidioidomycosis, blastomycosis, and we'll be dealing detail in mucormycosis. We have seen that it is mainly the clinical presentation is maxillary and orbital cellulitis, and it mainly occurs in uncontrolled diabetic patient with ketoacidosis. We have seen about that it is an opportunistic infection and it appears in various immunocompromised patients. Okay, let's start. Loss of tissue integrity and compromised systemic immunity. Okay, जिन cases में, for example, in immunosuppressive therapy in AIDS patients, in renal failure patients, in leukemia patient, or even in severe burn patient, जिन cases में loss of tissue integrity रहेगा और compromised systemic immunity रहेगा, this opportunistic infection takes place. That is mucormycosis. The nasal mucosa may ulcerate, exposing gray-black necrotic nasal cartilage, vomer, and ethmoid bone. So, the nasal mucosa will ulcerate and expose the gray-black necrotic nasal cartilage. So, it has a particular or peculiar feature of necrotic gray-black appearance, either in the nasal cavity. So, nasal cartilage will appear gray-black, exposing the vomer and ethmoid bone. Now, maxillary sinuses and ethmoid sinuses are usually filled with granulation tissue and sometimes bony sequestra. So, these both sinuses are filled with granulation tissue. And again, black necrotic bone. This black necrotic bone is a peculiar feature of mucormycosis. Now, palatal ulcers frequently occur and often progress to large oral nasal antral communication. So, there will be palatal ulcer and it will progress into oral nasal and antral communication. Now, coming to ocular signs and symptoms, they are epiphora, blurred vision, ptosis, eye pain, headache, and periorbital paresthesia. And they suggest the possibility of impending cerebral extension. So, these auricular signs and symptoms suggest the possibility of impending cerebral extension. Now, infection probably begins through airborne inhalation, which establishes an infection in only the compromised tissue of compromised host. So, they begin with airborne inhalation. Okay. Now, what happened in diabetic patient will be dealing, because it mostly occur in diabetic cases. So, we'll be dealing what happened in diabetic patient exactly. So, in the diabetic ketoacidotic patient, there is a high incidence of mucormycosis caused by Rhizopus oryzae, or also known as Rhizopus aureus. Okay, so the main organism for diabetic ketoacidotic mucormycosis is Rhizopus oryzae, because they produce enzyme ketoreductase, which allows them to utilize patients' ketone bodies. So, this organism produces an enzyme known as ketoreductase. What this do? It utilizes the patient ketone bodies. It is also likely that the hyperglycemia stimulate fungal growth. So, the hyperglycemic state stimulates the fungal growth. Hyperglycemia is the increased blood sugar level or blood glucose level. So it will stimulate, the blood glucose high रहेगा तो fungal growth ज़्यादा होगा. And what does it do? The diabetic reduction in chemotaxis and phagocytic efficiency. सो बोथ वेज, एक तो उसके लिए इन्वायरमेंट अच्छा कर रहा है, एंड दूसरा जो फैगोसाइटिक और कीमोटैक्सिक एफिशिएंसी है वो कम कर रहा है. तो इट इज़ वर्किंग इन बोथ वेज. सो दिस मेनली अकर इन डायबिटिक कीटोएसिडोटिक पेशेंट. Okay, now coming to the differential diagnosis, it can be extranodal natural killer T-cell lymphoma, nasopharyngeal carcinoma, or tertiary syphilis. Okay, that's all for today. Diagnosis and treatment plan will be dealing in next class. Till then, like, share, subscribe and comment. Bye.